So we are irrigating our patient's ear in an attempt to dislodge a little piece of wax that is right up against the eardrum that's causing irritation and has been ever since, what was it called? Tough Mudder?
Yeah.
Ever since the Tough Mudders. One particular event of the Tough Mudder was called the
Arctic enema.
Arctic enema.
So it was muddy ice.
And I just want to tell you that normally in the setting of an enema, it's not the ear that gets something in it. I don't know if the people that put on Tough Mudder know this. Yeah. Oh, somebody writes in that they've had this done and it feels good. LOL. Maybe the LOL means not. All right. So what I'm doing is checking to see if we're actually getting that little bit of matter I saw in the eardrum when I looked into the basin, but it's really stuck to it. And,
I'm not seeing anything.
no, we haven't yet. So you notice that we're careful not to use too much pressure and little pulses of pressure as she pushes the plunger down on the syringe. Now somebody just joined us, so we need to tell them the problem is there's something stuck on the patient's eardrum that is causing irritation. She can actually tell it's there, and it just looks like a piece of wax that's stuck there. Somehow it got washed in when a bunch of water got sprayed. Now, did you feel water go in your ear?
Mm-hmm.
You did.
Yeah, we had to go all the way under.
You had to go under it.
Yeah.
All right, let me see if I can get anything here. Can you hold this, and then we will see if we can actually look through this with the periscope. Ah, it's moving.
Good.
And actually what I'm seeing is no longer what I saw before. It's almost like a flake of wax that got folded on itself and crumpled up and was on the eardrum, and now it's unfolded and coming off. So this is working. Let's just keep doing it. Okay, thanks. And the way we do it here is we use warm water, because if you use cold water, you'll actually cause dizziness in the patient. Did you get any dizziness at all? No. Because we use warm water. And we add in some hydrogen peroxide, and that helps to separate the wax a little bit and soften it up. And then we just use is that a 20 milliliter syringe, I believe?
Yes.
A 20 milliliter syringe. And for a tip, we use a catheter. This here is a scalp vein set like they use in little babies, and we cut off the sharp needle and just use the hub here that goes onto the syringe, so you have just the smallest little spout on it. I'll try to get a shot of, see, it's just this little silicone or plastic tubing, just the tiniest length of it, just a ½ inch about, that goes into the ear canal. And oh, there, did you guys see something floating in there?
I heard something, I think.
Can you feel anything different?
No, no.
A bunch of light here. Where's that light coming from? Yeah, there, something came out.
Okay.
And somebody says Q-tips are bad to use, only for use around the ear, not in the ear. And as Dr. Appleblatt, the ENT doctor in Sacramento, says, Q-tips are the instrument of the devil. She's rather strong on that point. I'm going to take another look in, because I saw something come out, and I think, do you feel like it's gone, whatever?
I can't tell yet because I still feel water.
Yeah, you do. What? You know what? It's not completely gone. I can still see flakes of wax all the way back in there on the eardrum, very adherent to it. It's possible it was something that got washed in during the Tough Mudder, other than wax, but it looks almost clear, and wax does look almost clear when it's a very thin flake that just gets stuck on the side of the ear canal.
So how do you clean your ears if you don't use Q-tips?
Well, normally they will actually take care of themselves,
Oh, okay.
but some people will still get buildup even with just not sticking something in their ears. And so we'll recommend over-the-counter use of a product called Murine or Cerumen.
Okay.
And that will help soften wax. And then irrigation with just water, even though we try to get people not to put water in their ears because it can cause problems if it gets stuck behind wax. It can cause a fungal infection. Yeah, somebody's writing here, yeah, shower and then tilt your head, and of course that works if there's no wax to hold the water in. If there's wax holding the water in, then you want to use a product like Irrigation or Cerumen. And then of course you can go to your doctor and have this sort of procedure done. But I'm surprised, oh, somebody gave me a heart. They give us hearts. They tap on the screen and give us hearts when they like what they're watching. Here, I'll show you what it looks like. There.
Oh, that's funny.
They like your ear. Man, now there's a lot of them. Maybe it's just because I mentioned it. So what may happen here is that we don't completely make it look clear, that I can still see like there's a little flake of wax on it, but if you don't feel it anymore, if we get enough that you don't feel it, we'll stop at that point.
Okay.
Because we're not going to make you feel any better than if we get you to normal, and it just increases the risk of injuring the patient to keep going. Cell phones clear out wax also due to the vibration from the speaker. Wow, you listen to it so loud that it vibrates that you can feel. That would be one loud cell phone.
I'm not
Did
on
your
the cell
patient
phone
sign the
very much.
periscope medical release form? It doesn't say periscope on it, but it does say use of video and voice and image for any and all purposes with no claim for compensation, something like that. Kelly, did you read it?
No. Sorry. I trust you.
You didn't read the form before you signed it? Oh my goodness. We're going to come and collect your children after this. Okay. And you do have wonderful children, by the way, so.
Thanks.
No, I'll look after this one. All right. Take another look. Okay. It is actually gone now. Can you tell? Except for the water.
Yeah.
But the thing that's been going on ever since the Tough Mudder is
Yeah, it just feels like.
still even now?
No.
Oh,
It's
okay.
better. Yeah.
Okay, that was it. I just want to make sure that indeed was. I don't want to
Right.
assume that it was.
No, yeah, I think so.
Okay, cool. Well, thanks for participating in the
Sure.
video with us. And we'll see you next time. Probably at a sporting event. Maybe even a Tough Mudder. I don't know.
Next year.
Okay. Oh yeah, let me say goodbye to everybody here. Somebody loves ear irrigation. Late night. I love irrigation. Ear irrigation. Cool. Thanks for joining us. We'll see if we have something else cool for you. Probably not today because it's getting late in the day. You're welcome. You're welcome, Danielle. No, it says good job, Doc. I didn't do anything. They did the whole thing for me. All right, we'll see you next time. Thanks, guys.